Hi everybody, my name is Dr. Meredith Farmer. I am a neonatal nurse practitioner and the program director of the neonatal nurse practitioner program at Emory University. Today I'm going to walk you through a resuscitation in the emergency room, and first I'm going to talk to you about the equipment that you're going to need. Every emergency room needs to have this equipment available at all times because you never know when a mom's going to walk through the door and deliver. So the first thing you want to make sure you have is a radiant warmer. Of course, I don't have a radiant warmer here today to show you, but any radiant warmer is about the same. You need to make sure there's a switch, usually on the front of the radiant warmer. Just make sure you switch that on. But instead of just switching it on, make sure you add some heat as well, just by putting the arrow button up. Because you want it to be at about half heat, even if it's a term baby, because you want to make sure that they are adequately heated. I feel like a lot of times the main issue when the NICU does come down to the delivery room is that the radiant warmer's on, but it's not adequately heating the baby. The next thing you want to make sure you have is warm blankets, and I'm going to use towels to show you this. If you can have a couple of baby blankets in a blanket warmer down in the emergency room, that's really the best thing to have. If not, even if you need to, if there's towels that you can put in the blanket warmer, or even an adult blanket to put as the bottom layer, because you want to make sure the baby doesn't lose heat. So when you hear of an impending delivery, you're going to first want to take these warm blankets and you're going to want to lay them out on the radiant warmer. This causes them to stay warm because the radiant warmer should be producing heat at this point. And you're going to need these to dry the baby off and to stimulate the baby. So I usually put 2 blankets down when we do this. You're also going to want to get your neonatal crash cart. This is another thing that emergency rooms should definitely have in any situation, and just have that close to the baby's bed. And if at all possible, go ahead and have your bag and mask available for the NICU team or for whoever is going to be taking care of the baby. This is called a Neopuff. It actually connects to the oxygen on the radiant warmer. So there's going to be 2 silver switches. You just flip those on, make sure that the oxygen is running, hook this into the oxygen on the radiant warmer. Then you have 2 sizes of mask usually. This one is a neonatal, so this is for like preterm babies. If you can see, it's kind of on the smaller side. And this is an infant mask, so this is what you would use for a term baby. So I'm just going to presume that this baby is term. And I'm going to open this mask up. You're going to want to connect it here. And now you're ready to resuscitate if you need to. You can check your pressure by using your hand, making sure that you have an adequate seal, and pressing this button, because this is your PEEP. Anytime this is pressed down, you're giving the baby positive and expiratory pressure. Okay, another thing that would be good to have available is, depending on the baby's size, we will use plastic bags to put the baby in. This is more for babies who are like less than 32 weeks. And we use these because it will help keep the baby warm and protect the skin. So we can also lay this, here's what it looks like. It's also called the bowel bag, but you can even use Ziploc bags or the biohazard bags if you have to. Saran wrap works really well. Anything that will keep the baby from losing too much water through their skin, because their skin is so thin. We usually will put this down, and then when the baby's born, we just slide it in there and put it up, okay? So this is something else I would have ready if the baby's preterm. And then you always want to make sure you have a laryngoscope available. Make sure that will come on, because that is a problem. For a term baby, a 0 blade is what is normally used. For a preterm baby, a 00 is good. And then an endotracheal tube. So this is a 4.0. So this would be used for a really big term baby. So if the baby's over 4 kilos, that's when you could use this. And then if you have a smaller baby, this is a 2.5 ET tube. And this is what you would use on your smallest preemies, like 500 grams. So you just always want to make sure that you have available what you need, because usually the emergency room is quite far from the NICU, and it's hard to get help down there quickly. So the next part of the video, I'm going to go over with you the resuscitation of a baby. I'm going to walk you through a resuscitation of a baby who is born limp and not breathing, okay? Baby? Thank you. Will you help me with my resuscitation today?
Yes, ma'am.
So the first thing that we want to do when you get the baby, this baby is breathing, this baby is limp and doing nothing. You want to start drying and stimulating the baby. Will you dry and stimulate the baby with me? You want to do this for 30 seconds. Take a bulb suction, suction the mouth out, make sure there's no secretions blocking the airway. You continue doing this for 30 seconds and this dries the baby off. This also stimulates the baby to hopefully make the baby breathe. So after 30 seconds of doing this and it's not working, the baby is still not breathing, so it's still limp, you're going to want to start positive pressure ventilation through a bag and mask. So you put the baby in a sniffing position. You want to put the mask on, hold it in a seat position, and start bagging. So automatically when this is held down, this is giving the baby PEEP. If you don't have a good seal, you will not see the number on the manometer rise. You want that to be at about 5 because that's your peak end expiratory pressure, and you want that to be at 5 for any size baby. So sniffing position, hold this on, the baby's not breathing, we need to start giving breaths. When you press this, it's giving it a peak inspiratory pressure, or the PIP, and you give about 40 breaths per minute, sometimes 50, depending. And this is how you're going to do this. You're going to do this for 30 seconds. At the same time you're doing this, you're going to ask your helper to put an oxygen saturation probe on the baby. Just pretend. And turn on the oxygen saturation monitor on the radiant warmer. And if you have the ability for cardiac leads, it'd be great to put the neonatal cardiac leads on so you could actually look at the heart rate. Okay, so you do this for 30 seconds. The baby's still not breathing. Our heart rate is less than 60. You need to obtain a better airway. The first thing you want to do, though, if you're not having any success with chest rise, it's called Mr. SOPA. So mask, reposition, then suction the baby's mouth out to make sure there's not an obstruction. Then you need to increase the pressure. And then at that point, you need an artificial airway or an alternative airway. So this baby needs an alternative airway. So what I'm gonna do is I've got the laryngoscope. We use a 0 for a term baby. You're gonna wanna intubate. Will you hand me this when I need it, please? You're gonna intubate and say, hand me the tube. Put the tube in. So if this baby's 2 kilos, we wanna put this at about 8 centimeters because you're gonna do whatever you estimate their weight to be plus 6, and that's where the endotracheal tube needs to be. So after the endotracheal tube is in, you are going to want to put your bag back on, and you start breathing, and then you need to listen for bilateral breath sounds. Okay, so at this point, you have your alternative airway, you're still bagging, you need to turn your oxygen. You know, we start a resuscitation on about 21%, and at this point, we'd want to go up to like 40% on the oxygen. Thank you. And so this is because we want to, we want the saturations to be relatively normal. And since we are needing to resuscitate, this is when we would need to go up on the oxygen. So at this point, the baby's heart rate is still below 60. We're still not breathing on our own at all. We are having to breathe for the baby. So we will need to start chest compressions after 30 seconds of bag and mask, bag ventilation with the ET tube. So you'll ask your helper to start chest compressions, and you use 2 fingers. You put a mid nipple, like right between your nipples, and you do 1 and 2 and 3 and breathe. So let's start. 1 and 2 harder, 3 and breathe. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. Okay? So let's say now with that, the baby starts becoming active. We are breathing, and it can happen that quickly. Babies are very resilient, and sometimes all they need is a little bit of pressure, and they're able to, resuscitate relatively easy. It's something that you shouldn't be scared of, and just know that sometimes they need that little bit of pressure to help them, kind of get kick-started with life. So now our heart rate's over 100. We're still giving PPV. And the baby starts to become active. So depending on what the baby looks like, at this point, some people will pull the endotracheal tube if they're breathing a lot on their own, and you can just hold CPAP. This gives the baby pressure, if the baby's breathing on their own, and you will want to look at their retractions to see how they're doing. If they're really pulling hard, they might need to keep the CPAP on. If they are really active and fighting you and their work of breathing looks okay, you can try them off of oxygen. And at this point, you can wrap them up and give them to the mom. Another thing to think about when you're resuscitating is this blanket. You know, the baby was wet. We were drying the baby off. After about the first 30 seconds, lift the baby up and have somebody pull the blanket out from underneath you and put the baby on a dry blanket. That's why we need more than one blanket with us. So next, we're gonna walk through the whole resuscitation without me talking the whole time, just to kind of show you what it looks like in real time. Okay, here comes the baby. Thank you. All right, let's start drying and stimulating. Okay, can we take the baby off this top blanket? Perfect. Let's keep drying and stimulating. How long has it been? Has it been about 30 seconds? Okay, I'm gonna suction the mouth out. Head in sniffing position. Let's start bagging. Will you tell me when it's been 30 seconds? You don't really. Okay, let's put the saturation probe on the baby, please. No. And do we have any EKG leads that we can put on? Okay. Thank you. Okay, so it's been about 30 seconds. If you don't mind, hand me the laryngoscope. Perfect. Thank you. And will you hand me the tube? Or here, just hand me the tube first. It's okay. Okay. If you'll put that on the top. Perfect. And I'll take bagging. I'll tell you when we'll probably need to start compressions in a minute, so if you don't mind helping me when it's time to start compressions. What you'll do is you'll put 2 fingers in the middle, right between the nipples, and we'll go 1 and 2 and 3 and breathe, okay? All right, so it's been 30 seconds and we still are not breathing, so let's start compressions. So 1 and 2 and 3 and breathe. 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 Okay, it's been 30 seconds. Let's reassess the heart rate. Okay, so the heart rate's still below 60, so we need to continue compressions. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. And 2 and 3 and breathe. Okay, reassess the heart rate, please. So now we're over 100. And look, we're starting to move around and pink up. Yay. Okay, so I'm gonna actually take out the endotracheal tube and see if we can just do some CPAP. So we're still breathing. Our saturations are coming up. Our saturations are 85 now. So this is good for about 3 minutes of life. Okay, look how much tone we have now and how pink we're getting. Okay, so now we're gonna just try off CPAP and see what we look like. Okay, well, I think that we resuscitated pretty well. I think we can start wrapping him up and we can take him over to mom. Do you mind taking him to mom for us? Okay, so this is basically what a resuscitation looks like. I want to just give a shout out to my 2 daughters for helping me do this. I really appreciate their help. If you have any questions, you can email me at meredith.farmer@emory.edu. I would be happy to help you walk through anything.
Yeah, baby's breathing.